Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. We are back, ready to start Season 4.
And we have new things lined up, like this new BOC In Real Life episode.
You know it's coming.
I feel like it's every episode now.
We have a lot of exciting things.
So speaking of exciting things, before we get into this new episode, what we'll talk about, we have another exciting thing. We have a new podcast review.
It was so fitting. Yes, we do. We always love getting the podcast reviews because it's always cool to kind of read what people think.
And it's been a while.
It has been a while. You're right.
You want to read this one?
Yes. This one's by Rockin' Robin 53. Wonderful podcast using an engaging balance of education and stories. I love that they've also created a space on social media for ATs to share the ins and outs of the job, ask for advice, and just generally have a community in what can sometimes be a lonely profession.
Oh,
I know, that's really nice.
I love our community.
We do have a pretty dope community.
Yeah. It's all thanks to you guys.
Yes, 100%.
I know that sounds like really cheesy, but honestly, like it's not just us two.
It's not a community without the community.
No, I really love, I know that there's, especially like on Facebook groups, I feel like a lot of people are getting slack for like the anonymous posting and like I feel like there's a lot of like, I mean, social media, you have to be careful.
Yeah.
You know, and it's not open. You can't just always ask anything, but I feel like in our community, it's so open that you really can really go to athletic trainers within our community or us or just ask questions. And it's really just built on learning. And I think that's really exciting.
Yeah, 100%. We're always students.
Yes.
And it's true. Sometimes this profession does feel pretty lonely, especially depending on the setting you're at, right? Like some high schools, literally, you are probably the only athletic trainer at your school. And there's probably not a lot of other athletic trainers in that district that you're relying on, but their situations are different too than yours.
So speaking of learning, we decided that for this story episode, we're going to create a new series called BOC IRL, which is basically the BOC in real life. And this is not just for people studying for the BOC, but it's for like, we're going to go over like what, like quote unquote, like BOC topics, but really like what is in real life of athletic training and people actually, and we're trying to bridge that gap like we've always been doing through the podcast.
It's taking what the book says and what is presented in real life, because as we all know, real life tends not to be quite like what the book said.
Absolutely not. Absolutely not. So this one specifically, I figured we'd start with heat illnesses because I don't know how you guys are doing, but we're burning up over here in Southern California. And it's football hell week and camps and, just the start of fall sports. And
some people would view football as hell season.
Okay, we can get into that later. So anyway, we're just going to do like a good balance of like review and then like stories, and then we're going to chime in, and I think it'll be a good series.
Yeah, I'm excited for this because it's true, right? Like students when they're coming out, right? They have all this, like all the knowledge from, their courses and, again, what the textbook kind of hints at. And then when you kind of get that difficult case in real life, it's like, man, it didn't quite present quite like I thought it would because of just what I was anticipating from like what I was taught. So it's kind of cool to kind of see how just, again, medicine is an art. And sometimes, how just real life makes it an art.
Right. So anyway, I'm just going to get started in just basically like the knowledge of heat-related illnesses because they most often occur in those hot, humid, and sunny conditions. That's what we really think of as a heat-related illness.
Yeah.
You're not really thinking of it in like a cold environment.
Yeah.
But it can also happen due to heavy training, competing in cold environment, dehydration, which leads to heat exhaustion, heat stroke. And then also just, as we know, protective equipment that doesn't allow dissipation through sweating. So I did ask on our Instagram stories, which I should probably pull that up, if anyone had a heat illness that wasn't in the heat. And actually, 41% of people said they actually had to respond to a heat illness when it was not humid or sunny or hot.
Oh, interesting.
I was not expecting that number to be so high.
Yeah, neither would I. That's it. I mean, it does tell you it can happen at any time, really. Again, it is an individual response.
Right.
To the thermal effect of activity.
Well, if you think of also like the people who've had heat illness before are more susceptible. So if you factor that in, and then like heavy training, which is going to be any sport, honestly. Yeah. And dehydration, again, any sport / these athletes, a lot of them don't like water.
Yeah. Yeah, that's true.
So that's really easy. Like, you know how many of these kids are practicing dehydrated. So so Gabby L said, I had it happen in a basketball gym for a basketball game. It was cold outside, so they had the heater on in the gym. I was at a high school at the time, an especially small one, that barely had any resources, especially to dunk someone. I definitely wasn't expecting it to happen. Luckily, it was a post-game when she collapsed, so I sent my girls to get wet towels and ice bags for her. I was able to get her back without activating EMS, and was able to send her home with her mom later that night.
Nice. Also, yeah, a hot gym is the worst.
Ugh.
I used to be at a venue where the gym was a very small gym. So, first of all, they packed it in. So, a lot of bodies, small area, gets hot. But then because it wasn't our own facility, it was somewhere else. At a certain time, like the air conditioner would just kick off. So literally by the time the game's almost over, the AC is now off. Oof. And it's starting to get a little toasty.
Ugh. So, did you ever have any problems with like heat?
Luckily, no. Luckily, there wasn't really a lot of heat issues.
Especially at the end, I feel like that's like the worst time, because like that's when fatigue sets in, and that's obviously if you haven't been keeping up with your water intake, then that's when dehydration really sets in. Especially the basketball gym. I feel like that's really, I mean, you're running up and down the court. Yeah. You're not really expecting to have to treat for heat.
Yeah, seriously.
I mean, yeah, like you see them like they're working really hard and like they're sweating a lot, but I feel like you're not going to I would be very surprised. Now, please tell me if you do, because I would be pretty amazed if you set up an ice tub in your basketball gym. I mean, maybe you set up in your ATR.
I was going to say, well, if your athletic training room is kind of connected to the gym, you have that benefit.
That's true.
But I mean, it's not like sometimes it's not necessarily close.
Right.
So it's going to take time to get the athlete there.
Right. So someone anonymous sent in, they use a taco method for a quick cooling. So you lay the patient on the tarp, you hold all four corners up, and then you dump ice water on them. It's quick, efficient, and cost effective. Yes,
most definitely. It is a pretty effective method for sure.
Right. Something that we practiced in our heat emergency day was to get someone in the middle of the tarp. You can take half the tarp and you can like scrunch it up almost like accordion, and just like scrunch it up like almost like you're gonna like put a sock on. You know how you like scrunch your sock, and then you lay the tarp next to them. You can log roll the person onto the tarp, and then you spread out that part you scrunch, so they're automatically already in the middle. You don't have to like burrito roll them to the middle of the tarp, or have to pick them up and get them to the middle of the tarp. You can just kind of roll them over.
That was the interesting thing to watch, like watching the students try and critically think, like through that process of what to do. Because also too, like you can walk on the tarp. It's okay. Like you can lift the kid, walk on the tarp, just don't be in the tarp.
Right.
When we're lifting the tarp. So like I think it's tough too, because for that emergency day, they were coming off of spine boarding stuff. So spine boarding, right? It's all very careful, precise.
Right. You don't want to move the patient.
Yeah. Heat illness, we're not worried about C-spine. We're trying to cool them.
So, well, I really hope you're not worried about C-spine.
That'd be a bad day if you're worried about both.
Oh, man.
But right, more than likely, it's just the heat illness, right? You can move that person, like, as long as their head's not like, flopping around. Yeah, flopping around.
Right. Also, just I mean, that's just where practice comes in, because, you know, we like putting the towel under the arms to keep them out of the, keep their head and upper body out of the
water.
Out of the water. I mean, not their upper body, but.
No, I see what you're saying. Yeah, because you don't want them to start to slump down, you know?
Right. So our MVP, Nicolette.
Nicolette?
She also weighed in. She said, slush towels are the best prevention tool. When you put them out preventatively at games, kids eat that up.
Yes, they do.
So speaking of prevention, we are gonna. So the way that I format this is, I just kind of did the main heat illnesses, and then we're talking about those, and then at the end we'll kind of go into like prevention strategies.
Nice. Which that's what I used to do for soccer. Like if it was a warm day, I always had my ice towels, and anytime someone came off, or like if it was the half, oh yeah, I was throwing that stuff out there. Man, those kids loved it.
So I've been reading a lot into this because it's something that I think I'm going to change for this season.
Okay.
For our ice towels, I've been reading that if you put them on the back of the neck, it actually tricks the body into thinking that the blood or the body is cooler than it is, because that neck, like the blood within those arteries goes straight to your brain.
Makes
Whereas
sense.
like if you cool your arms or like your distal extremities, you're more likely to get a quicker cooling of the body because of the circulation, and like you're not. Am I explaining this right?
Yeah, I see what you're saying.
Because if you put it on the back of the neck, your body thinks it's cooler than it is, so it stops the cooling.
Yeah, so
it's natural cooling.
Because the temperature of the blood going to the brain is going to be cooler than what's actually the core temp.
Right.
Makes sense.
So what I'm going to do instead, and you're supposed to like dunk. Some people say you can dunk like from bicep down, or you could just dunk the hands. I have a feeling that some of my athletes are not going to be very happy if I ice their hands so they can't feel when they're playing. So what I was thinking was ice towels, like squeeze it down their arms and then wrap it around the wrists.
Nice.
Because then you're getting good artery flow.
Yeah, for sure.
And venous flow.
Yeah.
Both.
Yeah, no, for sure. And
then like on the top of the head just because it feels good. I don't think that really
it does feel nice.
Right.
It does feel nice.
So I did specifically put into this episode heat illnesses, but I did want to also talk about just non-heat specific differentials of exertional hyponatremia, exertional sickling, diabetic emergency, and concussion, because we're not specifically talking about those because they're not heat related, but anytime that you're dealing with any of these symptoms, those are kind of some things that you want to think of.
Also, I mean, not necessarily heat illness, but can be contributed by heat is rhabdo.
Yeah, I don't know why I didn't put that on here.
It's tough because you can get rhabdo without heat too, but it's not necessarily like heat causing it. It's just it has a higher chance,
right?
A higher risk,
right?
Which I've had an athlete with rhabdo too. Yep.
So first heat illness that I put on here was heat rash or prickly heat. Have you ever dealt with that?
I've never really seen someone get like a heat rash.
Oh, really?
Yeah.
I've had a couple actually.
I'm trying to think, and not one sticks out like, oh yeah, dude, that's a heat rash, bro.
So for what this is, it's basically a red raised rash that occurs when the skin is continuously wet, like from sweating, and it's usually like on areas that the clothing is covered, because it's like harder for the body to like wick that away. Usually because the area stays wet, it could cause like that red raised rash. And usually the athletes or the patients, whoever you're working with, they'll complain of like it's prickling, it's tingling, like it just, that sweat sitting on the skin doesn't really feel good. So I've had two main ones that really pop out to me. One that you've probably seen before is from the tape. So it wasn't a tape rash. No, sorry, it wasn't tape. It was the brace, the ankle brace. So underneath, I had I think she's volleyball player. Underneath her brace, she would get this like red raised rash. And it was because of like just the sweat that would pool in that area. So what we would do for her is we would get, I can't remember if we did baby powder or if we did something else to like dry the area before she put it on, and it really helped.
Nice.
And then when I worked in performing arts, I had a costuming tech who they wear these like really thick polos, and she was working like this area where costumes were, and for some reason, I don't know why, because that doesn't make sense for the costumes, but it was super super hot in the room. It was also the second floor, So
Ugh.
it was super, super hot in there. They didn't have air conditioning. And so she would get like super sweaty.
Yeah.
And it was right around like her traps. It was like right under that collar, on both sides.
Oh, poor thing.
Right. So, we talked about, getting a fan. We talked about, continually like toweling the body.
Nice.
So that you can, well, that's technically
what
the book recommends is like toweling the body, but just because you want to keep that area dry. So I was able to get her, drying the body. She has, the costuming had a lot of extra towels, so she was able to keep one of those. She would change from like the morning to the afternoon into a different shirt, and it totally cleared up.
Nice.
Yeah.
Nice. That's awesome.
And it's literally just because the sweat sits on the skin.
Yeah. Oh, that's awesome.
Yeah. And when she came to me, she was like, it was like I had just been reading about it. And so it was perfect timing because I was like, so I think this is what you have.
That's pretty funny.
So the next kind of like progression of heat illness would be a heat syncope. And this is when someone stands in the heat for a long time. I'm sure you guys have all seen this.
Yeah.
Blood pools in the extremities. It honestly, like, there's a lot of factors that it could happen. What I call like our fancy terms is peripheral vasodilation of superficial vessels. So basically the superficial vessels, like near the skin, like near the top of the skin, peripheral, so like away from the heart, vasodilate, so they bring blood to the areas of like the hands and feet, which means away from your central nervous system, and then you faint to correct that position. Or correct that condition.
Yeah.
Have you had a heat syncope?
No, I haven't had someone actually pass out.
I feel like you see this in like weddings.
Yeah, I was just saying, first thing I thought of was weddings when groomsmen are just standing, lock out their knees, and then,
I think we had a friend
down
that
you
happened
go.
to at their wedding.
Yes, we did. There were ATs at that wedding too, so they were ready.
Yes.
That person was in good hands.
Yes. I feel like this one's pretty straightforward. I didn't ask for any stories about this one because I figured heat syncope, like, I guess some differentials, like anytime you have a collapse, you got to worry about exertional heat stroke.
Yep. Absolutely.
What else? Diabetic.
Yep.
Emergency. You've had a diabetic emergency, a random.
I did. Yeah, you're right.
Pop.
Yeah, they weren't sure if he was diabetic, right? I think they were.
Like, he was kind of on the edge.
Yeah, I think he was like testing for it, or he had like a strong family history of it. I'm like, oh man, it sounds like you might have it.
Right. So like you have to have other differentials, but usually if you lay them down in a cool environment.
Also heart.
Oh, absolutely.
You gotta think heart.
Absolutely heart.
Because you don't know what, they were exercising, passed out.
Right. Or even if they're not exercising and pass out.
You would still think heart.
Right. You pretty much treat this like you would a normal syncope. Okay, so then now we go into exercise-associated muscle cramps or heat cramps.
Oh, the fun stuff.
This is the stuff that I feel like you're gonna see this so much.
Yes.
And people treat it so similarly but differently.
It's cramping's already very complex. So it's one of those things you just kind of shotgun it and hope one of them works, basically.
Right. I was listening to this podcast that was talking about, because you have the various differences of what causes cramps.
Yeah.
And they're saying, like we've been talking about like electrolyte based a lot, and obviously it's individualized, but they're really finding that fatigue is really the number one cause of cramps, which kind of makes it hard to treat.
Yeah, I would say, again, I haven't dived in, to the research that much, but I see hydration have a big role too.
It could be also all the, just because like the fatigue is like number one doesn't mean that like you can't treat the other things and get them better. You just like fatigue, you kind of have to just rest.
100%. Yeah.
So book definition is overload or fatigue of muscles that cause muscle twitching and or cramping in the calves, abdomen, hamstrings, or quadriceps, basically like your body.
Yep. body.
Big muscle groups in your body. Whatever muscle group is like most demand during the exercise obviously is most likely to become the cramper. It's also, the research is also kind of like up in the air, similar to like regular cramps. Like right now, regular cramps are more fatigue based, and heat cramps are more due to like water loss and depletion of electrolytes. So kind of like what we were talking about, electrolytes being sodium, chloride, potassium, magnesium, calcium. But essentially the treatment recommended is like replace fluids, electrolytes, mild stretching, ice massage of the affected area, which
everything.
Yeah, just shotgun, try everything. Honestly, I know some people have sent this in, and then also some people, some like my coworkers, really swear by the topical fuel. PHUEL.
I've heard it.
It's like a foam. You like just rub it on the area. I don't know what it does. I mean, it helps cramps, but I don't know the like specifics.
Is it spelled that way? Mm-hmm. Well, judging by the spelling with the pH, I'm sure it has something to do to correct the acidity. Because an acidic environment is very damaging to the cells, and it can help accelerate that fatigue. So if it's creating more of a basic environment, possibly, then that could be where it's going. That's my best guess. I don't work for fuel. I'm just guessing by the spelling of the product.
Right. I mean, I should just, we have it at work, so I should just go and look. I'm
sure they have like on their website, I'm sure they have like, here's proposed what it's supposed to do.
What I do is, especially if I'm trying to get them off on the sideline, like I'll utilize like reciprocal inhibition. So like if it's their calf, like I'll have them walk backwards so their calf's not like like pushing off. So I'll have them walk backwards, trying to get that tib anterior working more. And then I have them lay down. One actually, and like I'm not trying to call out any ATs, but when I see people like especially calf cramps, is first thing to do is stick the leg up in the air and start massaging it or start stretching it. And it just seems very backwards to me because you have like, you're trying to get gravity to work with you, not against you. When you stick the leg in the air, all you're doing is bringing the blood flow away from the area. So usually I just lay them in the hook lying or like bend their knees, and then I'll massage their calf or like whatever. I'm using the blood flow to my benefit instead of like getting it away. And then that's like one of the things I tell my students, like, do not stick their leg up in there unless it's like a hamstring, but like that's
you're kind of limited
on
what you can kind of do on that one.
And then if it's really bad, like I had a couple athletes who it was just like they're from like abdomen down. I was like, all right, you're getting in the ice tub.
Yeah, seriously.
Because
you're dunked.
Right. Like you're not dealing with a heat exhaustion or a heat stroke. Hopefully not yet. But,
hopefully not yet.
You know, if your whole body's cramping, let's just like get you in, calm down the area. I try to get them to like do little movements in there too. Like pumps or like just move their legs or something. You want to read the story about cramps?
Yes. So this one's by Anonymous. My first 6 hours as a sports medicine student, we had a heat-related emergency that had to be transported to the hospital. Collegiate women's soccer player during a 2-a-day practice. She made her way in weight, but just barely, and was allowed to practice with modifications. Halfway through practice, she goes down with a calf cramp. My preceptor ran over to see what was going on, and us students followed. Her cramp started in the calf and then started to go into her quad and hamstring. Then both legs started cramping fully. I had seen muscle cramps in 1 or 2 muscles at the same time before, but we were looking at 6 major muscles cramping at the same time.
Ouchie.
Yeah, seriously, man. That's brutal.
I know.
Then she started to cramp in her arms and hands as well.
Wow. That's kind of scary.
That's wild. I had never seen full body cramps before or since. It was a hot day in the summer, and her temperature was elevated above 100 degrees. We put her on the back of the cart and drove her over to the ice bath we had on the side of the field. Everyone talks about trying to pick up a passed out patient and how it's like picking up a sack of potatoes, but I had never experienced picking up someone who was stiff as a board.
That's crazy.
I know, because cramping.
Right.
Yeah, that does make it difficult for sure.
You know what? I got to say, like, the first time you actually feel a cramp is kind of nuts.
Yeah, for sure.
Because like, especially, or the first time you see one, because you can see
the contraction.
Yeah, you can see the contraction, how it just like...
And it's weird because they're not doing it.
Right. And most of the time they're like just freaking out about it.
Yeah.
And you're like, okay, let's try to calm this down.
Yeah. She was like a pair of super starched jeans back in the day.
Oh my gosh.
We transported her to the athletic training clinic and continued treatment there, but her cramping never subsided and she was struggling to rehydrate. We ended up calling EMS when she was still cramping 35 minutes later. Man, that's tough.
a long
35
also,
minutes of cramping.
Ow.
Yeah. And there were no signs of improvement. According to my preceptor, she was still cramping at the hospital, and they had to give her something to knock out to then be able to put an IV in and rehydrate her.
Wow.
That's crazy. She ended up doing good and was back in practice the next week. It was quite the experience for my literal first couple hours of being an AT student in my program.
Seriously.
That's crazy.
Also, I feel like you'd be so sore from that.
That's what I was thinking. I was thinking the follow-up, I was like, oh, I bet like she was just super sore.
I'm
like
surprised
just
she
everywhere.
was able to go back the next week. That is nuts.
Yeah, for sure.
It makes sense, the whole IV and rehydration, and man, they had to knock her out that just...
Yeah, just to get the IV in.
Right.
Oof.
Wow. I'm surprised. See, then your mind is going, okay, is it more like a rhabdo or...
Well,
like...
that's what I was thinking. Now the follow-up too, because of depending on how intense the cramps were, right? Now you have to be worried, was it so intense that could it induce a rhabdo situation? Which I'm sure that was monitored when
right.
she was in the hospital, and obviously the days later, kind of making sure that's not a possibility. But still, that's something to keep in mind on follow-up.
Mm-hmm. Do you have any cramp stories?
Not really, just because, again, most time with like track, that doesn't necessarily, I mean, it can happen, but it's not like, it's not a continued thing, right? Except the distance athletes, but
once you cramp, you're done.
Yeah. And then even when I was working soccer, I didn't have a lot.
That's good. You guys also kind of, it was like cold nights. And
later in the season, yeah. Early on, we'd have some warm games, but it didn't happen that often.
Right.
But yeah, we really weren't in the heat that often.
We had some pretty good cramping when I traveled with my co-head to women's soccer for state championships.
Oh, I could imagine. Especially being state.
Well, because it was also, we had a lightning delay, and which was like an hour, and then the two halves. There wasn't any extra time, but I know they were playing, obviously really hard. Yeah. So we had some pretty good cramping.
And also, it was cold.
And it was also a weekend of soccer, so it wasn't, it was like back-to-back.
Back-to-back games. It was cold, so maybe some people didn't feel like, oh, I need to hydrate as much.
It's hard to hydrate when it's cold.
Yeah. A lot of factors there.
Right. Also, you don't think about, like, when you go on a plane, like dehydration on a plane.
Yes, yeah.
Like, true. We didn't go on a plane, but, like, you know, the teams that travel.
Yeah, I was going to say travel in general, like sitting on a bus, right? Like,
right.
I don't know. I just feel like it's harder to hydrate when you're traveling, especially because, like, when you think about it, right? More than likely you're going to stop, get food. I mean, in perfect world, the athletes should be getting water with their meals, but let's be honest.
No.
Probably not. I'm sure someone got a soda.
Soda, coffee, shakes.
Oh, yeah, because we're traveling. Let's have fun.
Right. All right, you ready to move into heat exhaustion and heat stroke?
Yeah, let's do it.
All right, for heat exhaustion, it's like the more moderate form of a heat illness where it starts with dehydration, the patient's dehydrated, and it's to the point that they're unable to continue that intense exercise. Yep. The biggest difference being between that dehydration and the heat exhaustion is that inability to continue. Yeah. Because, like, you can practice dehydrated. Yeah. Heat exhaustion, you have to stop. And then heat stroke, you collapse. Yeah. I mean, you don't have to have a collapse, but, like, you're not doing you really great. Can't continue. It's
the nervous system's going haywire.
Right. There's the biggest difference also between the heat exhaustion and the heat stroke is the rectal temperature. It's 105 is that cutoff. But also, without that rectal thermometer, the CNS involvement. Yep. Which we'll talk about. So,
which, by the way, that 105 is updated from when we were students. When we were students, the magic number was 104.
You know what? Okay, I'm glad you said that because
Yeah.
I feel like I was thinking that, and then
I mean, granted, if it's borderline, you're
right.
probably just
you know what? Actually, the position statement does say, even if it doesn't hit that magic number 105, you should still treat it as a heat stroke.
Yeah, 100%.
Because you don't want it to get there. Like, you have to stop its progress.
Yeah.
That's the thing. Is like dehydration progresses into heat exhaustion, which progresses into heat stroke, which is why it's so preventable and why it's such a heartbreak when you hear about these cases that no one had treatment for.
Yeah, well, and again, it goes back to the importance of having an athletic trainer.
Absolutely.
There. Yeah.
Or even if you're not going to be there, having coaches be able to identify and realize how dangerous it is.
Yeah, how significant this is.
I think something that really put it into perspective for us, and this isn't like sport related, but it is activity related, when we went to, we just went to Pinnacles National Park, which was so hot. It was so hot.
Yeah.
And they put a warning out that said you can't hike, or you can, I guess you could do whatever you want. But it's really, really highly recommended that you don't hike between the hours of 12 and 5 p.m.
Yep.
And, we were finishing hikes.
We were good noodles.
We were finishing hikes like early in the morning, like whatever. And people were out there starting their hikes at 12:30, 1.
Yeah. Uh-huh.
And I think honestly, I think people don't realize that heat kills.
Yeah.
Like, they're like,
100%.
oh, like, it's going to be hot. It's going to be miserable. It's going to suck. But I don't foresee death.
An issue. Yeah.
I don't think people realize.
Yeah. It's crappy.
Right. And so, you have to put your coaches in this position because it's not like they don't have the same schooling as you most of the time. Mm-hmm. Yes, they've been around athletics and they've seen like people dehydrated and cramping and like stuff like that. But we need to do a better job of educating those around us. Because like I've had coaches who didn't know the signs. Yeah. And then, if they don't know the signs and you're not sitting at practice, which a lot of times, like, depending on what setting you're in, like, you're not able to sit at practice, like, who's the person out there? It's the coach.
Yeah. Yeah, for sure.
So signs and symptoms are very similar to the signs of dehydration because it starts with that. So it includes like fatigue, weakness, dizziness, pale skin, and then it progresses into like profuse sweating, nausea, vomiting, headache or lightheadedness, persistent muscle cramps, dizziness, loss of coordination. I think I already said that. Yep. And also a low blood pressure. And I was trying to figure this out, like the reasoning behind it. And what's the easiest way to remember it? You have a low blood pressure with dehydration because if you think about the amount of fluid, because obviously the more water you drink, the more fluid you have in your body, the more blood volume. If you don't have a lot of blood volume, then you don't have my co-head really put it in a good way, like a water hose. Yeah. It's like turning the water pressure down. Yeah. Like you have less water going through the water hose, so there's less pressure
against the walls.
Against the hose wall.
Yeah.
So that's why you have a low blood pressure, because you decrease that volume. Even though it becomes more viscous, it still isn't enough to press put pressure on those walls.
Yeah, sure.
So treatment of heat exhaustion specifically is removing that person from activity, taking them into a shaded or air-conditioned area, remove excess clothing, lie them down, monitor vitals, and then cool athlete until below 102 degrees, and that's a rectal temperature, which I learned that your normal rectal temperature is 99.5 degrees Fahrenheit.
Okay.
I don't think I knew.
Not 98.6?
I mean, I guess you can kind of think of, if a normal like forehead or tympanic or like whatever you want to use is slightly lower, then you would imagine core temperature would be slightly higher. I guess I was just never given a number, but 99.5 is your normal core temperature.
And remember, it is also a range too, right? There's acceptable ranges.
Right, like my temperature runs low.
Yeah.
So like when I have a low-grade fever, it might be something like if I have a normal fever for
Yeah.
someone else, it's actually higher for me
Yeah.
because I have a low temperature.
Yeah, 100%.
So like that's like the number, like the book number, right?
Yeah.
This is exactly what we're talking about. The book
Yeah.
versus
Real life.
exactly
IRL.
right. And then I was also trying to find information like how long you're supposed to dunk someone.
Yeah, that was a good note.
So this is from Casa, Douglas Casa.
The guy.
If you have, so I don't know about like above 50 degrees, but they specifically had for water temperatures below 50 degrees, which sounds really cool. I usually have it between 50 and 60. So
Which that's what most,
right.
like, because you're using the cold tub that you would normally use for cryotherapy anyways.
Right.
So that's what most people do. But I could see like if you're trying to be like, oh, I'm trying to make you like the emergency one, and people just keep throwing ice in it, I could see how it can get below 50.
So any immersion time in water temperatures below 50 degrees should be restricted to about 9 minutes, and it's because any heat generated from exercise should be dissipated within that 9-minute time frame. So any heat, like, because you start at, let's say you start at 99.5, whatever you go above that, even to 105 plus, like it should dissipate in 9 minutes if the temperature is below 50. If it's higher than that, you're going to need a longer time.
Well, and two, that's why you have your threshold on rectal temp, right? You have that magic number of, that 102, trying to get below 102 to know when the athlete can be pulled out, and also to make sure you don't cool them too much, because if you start cooling them too much, then it ends up going the other way.
Which they also said the effects of hypothermia was better than like dealing with the effects from treating someone and making them too cold was better than the opposite of not treating or not treating enough.
Exactly. So just keep that in mind while you're monitoring, right? That's why we have that magic number when it is safe to pull them out and transport them. But also just don't be like, all right, we're waiting to get back to our 98, 99, because that could now create another situation that could have been prevented to begin with.
Right. So this one from Kjersten M, you want to read this? It's a really cool story about dunking that you wouldn't think of normally.
Ooh, okay. Had a ref that wasn't able to keep up on one of the hotter days. I can already see where we're going. In my opinion, he should not have physically been cleared to ref. And we dunked him, fully clothed, mid-game.
You don't think about having to do that.
Yeah. I have some experience with this after this story.
Okay.
This was D3 football in September in upstate New York, which is hot and humid for sure.
Yes.
It was the crew chief, the white hat ref, and he handed his hat off to the next most senior guy and played continue.
Which is crazy to me. I mean, I know the game must go on and everything, but like,
well, we can't stop the game. We gotta keep going. From what I remember, it was a long day, and we dunked a few people. Oof, tough day.
I bet.
When we were out giving refs water, he mentioned that he wasn't feeling great, but thought he could continue. He looked to be slowing down a bit, and after a few plays, flagged us down and walked to the sideline. One AT and the doc, along with some AT students, took a quick history and vitals and helped start him with oral fluids and using ice towels. But that process is just slow. Mm-hmm. The crew I worked with at the time used the ice bath frequently for our team, so this wasn't necessarily a last shot intervention.
Which I think is a good policy.
Yeah, it's true.
Like, you don't really want to wait till, like,
we're downhill.
Right.
We took his temp orally during this time, and he never got to the slurred speech and shuffled gait that I see for emergency dunks. Essentially, it came down to the fact that we had at least half a game left, and it was a hot day, and this was a big guy. So we knew this would work and do the job quickly. I think our doc called him the next day to make sure he was still doing okay and had made a follow-up appointment with his PCP. That's crazy. So I have experience with this.
Do you?
Because most officials, I think we can agree, tend not to be of the younger crowd.
Officials scare me. Officials and running backs. They scare me.
Also, if you have worked track officials definitely are
No.
not of the younger
No.
crowd.
No.
So we, I think this was when we were working U.S. juniors up in Sacramento a few years ago. And Sacramento in the summer, it's an oven.
Absolutely.
It was miserable for everybody. I couldn't imagine being a competing athlete. I was standing there and I was dying.
Ugh.
But we had a lot of officials just struggling with the heat. I think we almost had more calls for officials
Really?
to be treated than we did like necessarily athletes needing something ASAP.
Well, elderly is one of the
Yes, it's a big risk.
risks for heat exhaustion,
Yeah,
heat illness.
they have a tougher time regulating their body temp.
Elderly, babies, those with a compromised immune system. So like if you're sick, don't be practicing in heat.
But yeah, no, we definitely had the officials kept us busy and as far as like heat stuff.
Oof.
Yeah, it was not good. We had tubs everywhere. We had tubs with because it's like a national championship kind of style. Like there are no coolers, so everything is bottled. The water has to be bottled. The Gatorade has to be bottled. Like everything's a bottle.
So actually,
it's a drug testing thing.
Oh, that makes sense.
Because the bottle's sealed.
Right.
So no one can tamper with it without you knowing. Whereas if there's coolers, anyone can put anything in the water.
That was like back way back, like one of our first episodes, probably with horrible audio.
Throwback.
With Bill Ito talking about international travel.
That's right.
And how they couldn't get water for an ice tub. So they had to use bottled water, and it was probably the bougiest ice bath.
Yep, that's right.
Ever, because
like
they
water.
poured like avian water.
Yeah. Yeah. It's so different outside the U.S. Like even just a simple concept is ice. Like ice is a big deal here. Outside the U.S., ice isn't really like, not a lot of people, use it or have that much access to it. Like that's kind of a U.S. thing.
Interesting.
Yeah.
Same as coffee.
Same as coffee, as we learned from the store.
Yeah.
Just some random guy was telling us
we're just picking out some tea.
Yeah, just picking out tea. We made a friend at the supermarket.
We made a friend. Okay, so moving into exertional heat stroke. So again, this is obvious. Most severe type of heat illness. It can change from heat exhaustion to heat stroke very, very, very fast. So I think people don't realize this. Why? Because, heat exhaustion, you really, like, you go from dehydration to heat exhaustion, right? You kind of get to that point that you're not really able to continue. And then heat stroke, boom, you can't continue at all. Two main key diagnostic criteria are obviously the core temp is going to be above 105 degrees. And then the CNS dysfunction. Yeah. So CNS dysfunction, like we were talking about, this is stuff like bizarre behavior, altered mental status, confusion. You could have seizures, emotional instability, disorientation, and they could go into coma. They also might have flushed skin, but they're going to have less sweating because the body's trying to conserve that water. And then the flush skin because the blood is going to the surface of the skin to try to dissipate that heat in that way. Low blood pressure, again, follows the dehydration, lowered amount of fluid, following heat exhaustion again, lowered amount of fluid, and then heat stroke. So you're still going to maintain that low blood pressure, but the pulse rate is going to be high, like 160 to 180, because you have that lowered amount of fluid. Your heart is going to really be pumping that fluid to try to get to the same amount of output that it had before with more fluid.
Yeah. Also, another thing when we talk about CNS dysfunction and just the altered like behavior, right? A lot of these athletes will be combative, right?
Yes.
And it's not like get away from. No, like they are very combative. Like I've seen it to where multiple people have had to keep one kid in the tub,
right,
to cool him off. So, like it's like when we say combative,
right.
I think some students don't necessarily know what that means or what it looks like. Like no,
until
like,
you see it
they may want to take a swing at you.
Right. They don't know. They're not in their right state.
Their central nervous system has went into literally that fight or flight, like survival mode, while being on haywire. Right. So all it knows is I don't feel great.
Right.
Things are happening, and you guys are doing something to me.
Right.
So,
as someone who's been a lone AT somewhere, like you can always use. So I always tell my students this, like, if you're working within a team, you have very capable, athletic teammates who can help you, or coaches who are also more than willing to be able to help you too. I had a football athlete who collapsed, and he was so combative. He did not want to get in. We had to drive him up to the ice tub. He did not want to get in the ice tub. He did not want to stay in the ice tub. And like, I always tell people, like, first of all, don't be in swinging range. Yeah. And second of all, like, you have to just depersonalize it and know that it's not towards you. Yep. It's their brain. And the same thing happens, like, you could happen with a concussion too, right? Yeah. Mm-hmm. So you want to read the story from Spencer?
Yes. So the story is by Spencer P. Most terrifying day of my life. Had an athlete with a rectal temp of 104. Completely unconscious, non-responsive to any stimuli. He was out for at least 10 to 15 minutes. Traumatic, to say the least. When EMS arrived, his temp had dropped, but it turns out the probe slipped, which they said is super common. So often readings aren't accurate long term, especially once the athlete is conscious and starts moving.
So the book says, in order to like have the best chance of the probe not slipping, which I didn't know this. Which is why I was super excited that Spencer sent this in, because, we talk about rectal temp. No one really talks about their experience with rectal temp, especially like they're saying that it can slip and stuff. The book, so I was reading about this, says that, one, it's supposed to be 3 to 4 inches in. You can use tape to keep it in place, or this is kind of funny. Literally, quote unquote, the book says you can hold the buttocks together to keep the thermometer in place.
When they're in the water, that's gonna be tough. That's gonna be tough without either you getting in the tub too, right, or someone looking off and be like.
And this is what we talk about. This is what we talk about. What the book says versus actual practice.
I mean, I get it. Like, I mean, worst case, like if you're having issues with it, I mean, you want it to stay. Right. So, like, worst case, you're going to do what you need to do to make sure this probe stays. But yeah, that's going to be a fun one to explain.
Something that we haven't talked about or touched upon yet either is that you have a 30-minute window that I like to say before the point of no return. Yeah. So this is like when, like, organ injuries start to happen, or like I had an athlete who had a previous heat illness or a heat stroke. Like, you know how they say, oh, I had a heat stroke, and you're like, no, you didn't. This kid actually went to the hospital and had a kidney injury from heat stroke. And that was just because, like, his coach didn't know the signs and symptoms. He didn't have an athletic trainer there. He didn't know the signs and symptoms. He went home and was like not feeling very good, and then like went to another soccer practice, I think, and then like later went to the hospital, and then they started treating him. So like, you think like this is really delayed treatment. Yeah. If he would have gotten treatment within those 30 minutes, and he didn't have any like from what I know, he didn't have any problems that were more than just like he had damage. Yeah. Like, I don't think it really affected him that much. But like things like that could have gone really south.
Oh, 100%.
So you have a 30-minute window. It's not like the cardiac where you have like a 3-minute window and you have to like do things right away. You do have to do things very quickly because it does take time to do things. Like, for example, like with my football player, I want to say it took like 15 minutes just to get him on the cart, get him to the ice tub, get the ice tub, get this combative athlete in the ice tub and start to cool him before I checked the time and realized like we're already like halfway through that time frame.
Yeah, 100%.
And then just like a return to play for these, I know that I've seen like it takes like a month to get back after like a significant heat illness, but the book technically says it could be between a huge range. It could be as short as 7 days, or it could be something like 15 months. And it depends on several factors. They're going to do things like they're going to take blood tests, do blood markers, their psychosocial readiness. If there's an AT supervising, like, is there someone who can see these signs and symptoms, or who can they educate about that? And ultimately, honestly, it's up to the treating physician.
Of course. Yeah, most definitely. Yeah, there's definitely going to be a lot of follow-up in that regard, as far as, okay, looking at what's been damaged, you know, what are the markers of this organ damage, and so on and so forth.
Do you have anything else about like the heat illnesses themselves? Or like any...
No.
All right, so the next section we have is just prevention of heat illness, and I didn't go into like every part because this is so preventable, but I just kind of put in kind of the things that we got stories about too. One of the big things that I didn't really want to go into, but just to say it is, I mean, we've already kind of said it. Like, you want to identify those with a prior heat illness, with sickle cell trait, or any kind of conditions that would make them more susceptible. Like if they are coming right off a huge illness, or if you are dealing with like maybe the masters, and you're dealing with elderly in the heat. Like, obviously you're not really going to be dealing with babies in the heat or like competing in the heat, but you know,
still at the games. Like
definitely. Acclimatize over 7 to 14 days. So a lot of times your governing body is going to kind of talk about this. So like, for example, we work in the community college. We have a California community college constitution that kind of outlines what the acclimatization process is for like our sports. So we don't really have a say in that, but
and as does the NCAA. NCAA has that for at least the equipment intensive sports like football. And then they also have some recommendations for summer football as well.
You want to read this one from Anonymous?
Yes. So Anonymous says, I work at a small college in the South that doesn't have football, but we still have other fall sports in season: volleyball, soccer, cross country. We decided as a staff to create an acclimatization program for all sports to use for their preseason. We got it to pass, but of course some coaches were upset that they couldn't scrimmage another school until day 5, compared to day 2 like they did last year. Those darn 3 days. This is more so just a rhetorical / thought process type of question, but do other colleges use policies like this? Are other ATs pushing for this as well? Obviously, I'm happy with the outcome we got because it means our athletes are safe, and we're also covering our butts in a way. But trying to educate coaches on all of this is not easy.
It's absolutely not easy to educate coaches.
Yeah, and I think it's tough because it always depends on like the type of coach. Like,
right.
Most of the time, like I have coaches that like on hot days, like even though all the charts and stuff and the wet bulb globe says it's like okay. Like, there's not a lot of modification that needs to be done. The coaches modify themselves. And then obviously on the flip side, there's coaches who just, you tell them like, hey coach, we got to modify practice, and they like lose their mind. Like, so yeah, it all depends on that coach. And I just feel like once coaches like kind of feel it out there too, and they're like, man, it's kind of hot for me. Right. Like sometimes they kind of like, but yeah, no, educating them is tough.
Honestly, I think it's also hard because and this is exactly, again, for like the millionth time, what the book is versus like real life, because the book says you're going to want to do this gold standard. Like, here is how you prevent all this, and this is what's going to keep you good in court. Like, if someone sues you, or if someone goes down with a heat illness, like, why didn't you acclimatize? You know? But then, like, in real life, like, you put these things in place and you say, like, we have to acclimatize, we have to do this on day 5, on day 7, on day 14, whatever. But then coaches talk, and they're going to talk to other coaches in their league, other coaches in their conference, other coaches. And you know what? They're going to come to you and they're going to say, but this person doesn't have to do that.
I hate that. Like,
and you're like, just because I'm doing I'm giving you more. It doesn't seem like it to you because your focus is,
they're doing this.
Is like what you feel like you get to do, right? Whereas we're giving you like safer, more opportunity, but it's not seen that way.
Also, coach, they run their practice like this. Are you going to do that too, or
right?
No, it's a pick and choose. Like, they do it this way, but they also do this.
Right. At the end of the season, when that other team wins, they're going to be like, well, it's because they got to scrimmage on day 2.
Yeah, that made the difference. That was all the difference. Just like how every kid is going to the NFL.
Yep.
Same idea.
Yep. All during COVID, it was a coach who was like,
oh, goodness. Yeah, COVID.
oh, but this school isn't doing that. Okay, but that's not our policy.
Yeah. I love that part. Well, this school, I'm not there.
Yeah.
I don't know what to tell you.
Another prevention technique is to educate athletes and coaches regarding the prevention, recognition, and treatment of heat illnesses. We kind of talked about this, but Stephanie F. put it really great. She said, I tell them they have 3 things they have full control of: eating, sleeping, and hydrating.
Yeah.
And really, that's really basic how to put it that way. And like, it seems very obvious, but sometimes you just have to be the one to tell them, and they have to hear it from someone who's not their coach, who's telling them over and over and over again, like nagging a bunch of other things. So kind of just some of the like recommendations. They're going to need balanced food, fluids, electrolytes at least 2 to 3 hours before exercise. What I did with my team is I had them just all like, I did like a stretch and flex with them where we're doing like neck strengthening, and it was like half of our football team and half the football team in 2 days. So then what I did was I just like had them all come around, take a knee, and then I just said, hey guys, who ate today? And like, most of them raised their hands. Some of them didn't. And then I said, what'd you guys eat today? Like, what are some good sources of food to fuel you? And then they went around and they were like, they were just shouting out. So then as they were saying things, I'd hear them and like kind of like say it, right? Yeah. Beans, rice, chicken.
Nice.
Different like things that they were just saying. And so then I was like, you guys, do you hear all this? Like your teammates know what you need to eat. Yeah. Even if you don't know what you need to eat, like ask your teammates, ask your coaches, right? We have a food bank on campus. We have the CAF on campus. We have all these things. You ask your coaches, they have extra food, and there's no reason why you can't eat before.
I was gonna say also like something is better than nothing.
Absolutely.
Like if you're confused on what the right thing to eat is, I'd rather you eat just something than, I didn't know what was good for me, so I didn't eat.
Right. We did the same thing with sleep. So I was like, okay, who slept more than 8 hours last night? Yeah. And like we had a couple hands. Who slept more than 6 hours last night? We had more hands. Who slept more than 4 hours last night? More hands until like everyone's hands were raised, right? And then we talked about sleeping in a cool environment. Yep. How important that is to sleep.
Which it's getting harder nowadays.
Right.
Evenings are hot.
Right. The idea of, prioritizing your sleep now because that's when recovery happens. Yeah. There are multiple pieces of the puzzle. You have your food, you have your sleep, you have your hydration. And then I was like, okay, how much water should you be drinking? I always, to make it easy for my athletes, I always say, because I've read this recommendation of half your body weight in ounces. But for an active population, it should be like your body weight in ounces. Yeah. So I usually just give that recommendation. Oh. NATA does have fluid replacement, which we did an episode on.
Yes. Another throwback.
Which we're also going to talk about pretty soon. But essentially, like I just, this is how much you should be drinking. Average sweat loss is around 1 to 2 quarts of water per hour.
That's crazy.
Yeah. And well-acclimatized athletes are going to sweat earlier.
And more.
Yeah. And then fit athletes are going to sweat more, and well-hydrated athletes are going to sweat earlier. Yeah. So well-hydrated, they sweat earlier. Fit athletes sweat more. Yep. And if you are fit and well hydrated, which kind of equals well acclimatized,
Yeah.
then you're going to sweat earlier and
Yeah.
more. So you can kind of see like the relation of why hydration is important and why rebalancing your fluids or replenishing your fluids is important.
Yeah. So
Something
I'm the total athlete because I sweat at rest sometimes. So, boom.
you must be really fit.
Super fit.
So another prevention technique that was recommended was weighing high risk athletes before and after practice.
Yeah.
I used to do this with our football team. Anonymous. We have an anonymous story. That's actually some really good.
Yeah.
You wanna read this?
I've heard the, like, from a practical standpoint, the weigh in, weigh out is a really good way to go because it's easier to do compared to some of the other hydration monitoring techniques that are more equipment intensive and kind of personnel intensive.
Right. Well, also, like, you get like, the athletes can see right then and there, because if you do it on, like, we used to do it on Excel that would automatically, like,
Do the percentage.
do the calculations.
Nice.
And you can tell them right then and there if they are dehydrated or not, or like you can give them the recommendations right then and there. It's almost like an instant satisfaction, which does so well in this generation.
Yeah, for sure. And it does help. Like if you're telling an athlete, hey, you can't practice today, it helps give them a reason why instead of you just being like, you can't practice today. And they're like, I feel fine.
Right. You want to read this anonymous one?
Yeah. So Anonymous says, at my university, we do weigh-ins before and after practice for football during preseason for hydration purposes. The athlete is not allowed to participate in practice if they have lost more than 2% of their body mass and have not replaced it by the next weigh-in. Guidance for hydration are given if higher than 2% loss. We based our policy on the fluid replacement guidelines from the NATA position statement. The same information is also located in guidelines for heat illness. We utilize both athletic training students, athletic training staff, and coaches for weigh-ins, whoever is available that day/time. The athlete doesn't practice if they don't weigh in/out. Their coach coordinates that part more because of the weight of his authority. I get it. Weight. I got him. He's like our messenger in that regard.
So I was asking about like the modifications for this specifically.
Yeah.
Which honestly can be up to you, like how you factor that, or maybe you guys can put that in your in our Facebook group, which we'll talk about if you do this. And I remember like we would like also monitor over time. So like if this person is chronically like they're constantly not meeting their hydration guidelines, like we have to like we sit down and have like an actual talk with them more than just the simple recommendations. And then also you have to remember that the 2% of body weight and the weigh in weigh outs, like you also have to pay attention to what they're wearing before and after.
Yeah.
Because like if they're wearing their shoes before but they're not after, or they're holding their phone or they're not, like that could change a lot. Their wet clothes are going to be heavy. So just kind of thinking about some of those things. Obviously it's not going to be a perfect science, but at least to minimize some of that.
Of course, the variability.
Mm-hmm. And then lastly, one of our favorite things is obviously monitoring the environmental conditions, which we know that heat illness doesn't always just happen in a hot, humid, sunny environment, but you can take that piece, using your wet bulb globe thermometer, restricting activity based on the National Weather Service colored flag conditions. Those range between like 80 and 90 degrees Fahrenheit, which I didn't know this. You know how they have like the white flag, green flag, yellow flag, red flag, black flag?
Yes.
Did you know that it's actually you're supposed to like have those flags and post them?
Are you serious?
And it's like it's supposed to be like a warning flag, and from the book it says it's placed in a location visible from the practice field that is used to notify everyone using that facility what the conditions are and what the restrictions should be applied. I didn't know that. Which is so funny to me because like
I have text message.
Because what?
I have text message.
I know, exactly. I feel like I put up a yellow, like if I put up a yellow flag one day, people would be like, what?
What's going on?
Yeah.
They're going to be confused or not even notice.
Or even like like a green flag, like for me, even like I'd be like, okay, wait, let me go back to the National Weather Service and look up what this is supposed to be.
That's pretty funny.
So that's why they're actually like the flag conditions, because those are the colors used to put flags up. You're supposed to put them on the practice field.
Look at that. I didn't know that.
Yeah. Like, please tell me if you have actual colored flags.
Yeah, seriously. I'd like to know who
totally
has
make
that
my
and
day.
who puts it out.
Right.
I think this, like, the monitoring, like, this might be Julie Max got instilled in me because she got really nervous when it came to heat. Like, she did not play with heat. Mm-hmm. And I guess it transferred to me because when it comes to heat, I don't play with heat. So, like, this is where your environmental policies are your best friend. Because, like, when it was the hot time, I was on the charts and everything looking at, like, obviously, like, we had the wet bulb globe, so I could take a measure right there. But, right, what's going to piss off coach more? We all get to the practice field and I just tell them, hey, by the way, no practice today. Or, hey, by the way, you need to modify. Or at least giving them a heads up. Hey, this week, here are the days that are at least projected are going to be a problem. Mm-hmm. We're going to monitor each day, but just as a heads up, here's what's probably going to happen, or here's what you need to plan on. Right? So at least they know, oh, this might happen, instead of me just rolling up one day, coach, can't practice today. What? Right? Like, so yeah, I would look at the weather, I'd look at the charts and be like, hey guys, here's what the projected's looking. You need to do plan on doing this modification. I'd remind them that day, guys, it's still looking like this. Here's your modification. I would drill it into them every day that, hey, this is what our policy says. This is what the recommendations are. This is what we need to do.
And having that policy ahead of time and not being like, oh, it's hot today. Shoot, I need to make a policy.
Yeah.
Because that is the biggest, like, if you do this in service, or like the beginning of the season, you say, or like when it's not hot, and then you're like, okay, by the way, like, here, coaches, here's our heat policy. Like, if it begins to get hot, these are the things that we're going to do. When it's not like on the forefront of their mind, it doesn't feel like you're taking something away from them. And then when you do get to those, you'll be like, hey, remember that policy that we talked about before? We're just instilling this. Here's the numbers that we have to go off of, and blah, blah, blah.
Now, that's not saying it's going to go smoothly and coach is just totally accepting. All right, there's still going to be a time, no matter how much you do, how much you text, how much you remind them, there's still going to be that kind of frustration of, well, it's not that bad out.
Right.
Kind of thing.
Right.
So, but it minimizes how much of a confrontation you have.
Absolutely. In a very confrontational job we have.
Yes.
So that is all I have for heat illnesses. Do you have anything else for heat illnesses?
Nope. No, I think that was perfect.
Yeah, so this is, again, a new type of episode that we're trying to get out, where we kind of actually do a lot more. Because our story episodes, we're obviously still going to do our story episodes, but I'm also trying to just integrate more of, like, what actually is like our practice book say, like, versus like what people do in real life,
or what real life allows, absolutely. So hope you guys like this episode. Let us know if you did. We will be going back to our education and story episodes every other week. So next week we are going back to our education episodes, and then again we have story episodes just like this. If you want to submit a story for a future episode, you can go to our Instagram at AT Corner Podcast, where we have lots of different, like, things, polls, Instagram stories, Instagram questions that you guys can weigh in on. And then we have a Facebook group where you can post about questions you have about your practice, or just topics you want to hear from other athletic trainers. And that's facebook.com/group/AT Corner Podcast. It is a reporting year, so please take advantage of our free $1 and regularly priced CEUs. If you're listening to this right now, we have, I think, 1 or 2 more days of our sale. Yes.
We have 20% off right now, so pay attention to that. If you're not listening to it in the first 2 days of this releasing, then we're going to have more sales, so just keep an eye out on our social media for that. And
let's get those CEUs.
And speaking of CEUs, we're still working with MedBridge, so we have $150 off if you use code AT Corner. Again, all this stuff is in the show notes below.
Yep. And that MedBridge one, it's a year subscription, so it's good for this reporting cycle and the next.
And next. All right, Randy.
Thank you for helping us showcase athlete training behind the tape. Bye.